Good afternoon and welcome to the Baby Show TV. Hope you're having a great day, curled up on the sofa hopefully, done a bit of shopping, now having a little listen to some of our talks. Nice, it's raining outside and you haven't had to leave the house. How brilliant is that? So we're going to move along to our next talk now, which I'm looking forward to this one. It's all about how to stay active in pregnancy safely and how to look after yourself after you've had your baby. You know, what can you do? What's safe to do? And we've got a great panel coming up now to chat through this, but I'd like to welcome Claire, who is the founder of Natal Active. If she'd like to join me, we'll find out more.
Hi.
Hello, Claire. How are you?
I'm very good, thanks. How are you?
Thank you and welcome to the Baby Show TV. It's all rather exciting. It's all rather snazzy, isn't it?
Yeah, this is amazing. I'm so impressed. It's so professional. Brilliant setup.
We're doing our best. Behind the scenes, we're like squirreling away. All
yeah,
good.
I know.
All good. So tell me a little bit more about Natal Active.
Yeah, so I launched Natal Active back in the summer, right in the middle of lockdown, actually, which probably wasn't the best timing. But I'm a mum of 3 boys, so and a long-time runner. So I ran before I had children and after. And that was really the inspiration behind the business, because I didn't really ever find any nice maternity activewear, and I wanted stuff that was really convenient when I was breastfeeding, but also kind of looked and felt nice. So when my youngest started school in September, I sort of started work on it properly. It was an idea that had been building for a really long time. Obviously, I didn't really anticipate that I'd then be having all 3 of them being homeschooled while launching the business, but you know, it went okay. But I think as a result of that, it's also made me, as well as running the business, very passionate about educating and supporting women to be active in their pregnancies and you know, recovering properly afterwards, because it's a time when often many of us make too many mistakes and we maybe do things that we shouldn't have done too soon. I know I certainly was guilty of that. So that's why I was really delighted to be asked to come and do this today, because it's a really nice opportunity to bring some experts together, because while I can talk from a lot of personal experience, I'm not qualified to give any proper advice. And so the panel that we've brought together today can obviously do that on my behalf.
Yes, you've got a brilliant panel lined up to be joining you. This is brought to you again with Let's Bab as well, which we must mention. Do check that out again for some brilliant shopping. Check out Let's Bab after the talk. But yes, I think you're right, Claire. I just find the whole thing blew my mind, what my body could do, how I could make a baby, grow a baby, deliver a baby. You know, it is, our body is quite phenomenal, and it is important, isn't it, Claire, that we look after ourselves through all of that. We tend to focus on the baby, don't we?
Absolutely, and there's so many benefits, as we'll talk about in the discussion today, to being active in pregnancy. But it's also about doing it in a safe and measured way, and in a way that's right for you. So you know, it's a great opportunity to kind of communicate some of that with people that are looking to do it themselves as well.
So I won't eat up any more of your time. I'm going to pass it over to you to introduce your lovely panel. Everybody enjoy. Please do send your questions in. I'm going to be monitoring them, and I'm going to come back and join you, Claire, and feed you some of those questions at the end. Okay. That's okay.
Brilliant. Thanks very much.
Over to you. Over to you.
Thanks. So, as I say, I have lots of experience of exercising in pregnancy and trying to recover myself afterwards, but I'm not an expert. And so I've brought together 2 people today who are real experts in their field and will be able to kind of answer lots of the questions that I often get asked. And again, I'm always answering them from personal experience and very conscious to do that. So I've got Amal and Lulu with me today, and I think I will let you guys do your own introductions, because you can probably do that much better than me. So Amal, do you want to kick off and tell us a little bit about you and your background?
Oh, bless you, Claire. It's very simple. I am a sport and exercise medicine doctor. I have a specialist interest in women's health applied to sport and exercise and physical activity, so across the spectrum of movement. I am co-founder of Umi Health, which is a pelvic health focused digital education platform, which was launched earlier this year during lockdown as well. And I sit on the scientific advisory board for the Active Pregnancy Foundation, which is a charity, and I would encourage everybody to have a look at that at the end of the talk as well.
Fab. We'll do some links to that on Instagram and stuff later. Well, I think you're definitely more than qualified to be here today, so thanks for joining us. And Lulu, we'll move on to you. And I guess we should start by offering some congratulations, because you announced some very exciting news earlier this week.
I did. So I am a pre and postnatal fitness coach, and I am also a mother myself. I've got 2 little girls who are 4 and 2.5, and I'm currently 10 weeks pregnant with number 3, which is exciting but a little bit daunting at the same time. So I'm very much kind of living through what I teach, which is great, and it sort of enhances the experience as well, because it just reminds you actually what it all feels like when you're teaching clients. You know, it's all coming from the books and stuff, but actually it's quite good to go through it yourself again.
Definitely.
Even though it's quite daunting.
Yeah, you'll be fine. I'm sure.
You've got 3, you're sane, it's fine.
Yeah, I'm out of the worst of it now. I think it's a bit crazy at first, but you'll be okay, I'm sure. So I guess we should probably start by looking at, there is definitely a lot more talk around being active in pregnancy now, and why that's important. So Amal, what are the kind of guidelines around what you should be doing? And as a rule, do you find that is something that a lot of women are following, or is there still a need for people to perhaps be more active than they currently are in their pregnancies?
So this is a really important topic. Not least because we might be facing another lockdown, and during the last lockdown we had evidence to suggest that pregnant women's physical activity levels declined significantly, with a detrimental effect on specifically their mental health. So we have that research evidence now. There do exist worldwide guidelines, and we have our own in the UK, to encourage women to be physically active during pregnancy, because it is so important. We've talked about this before, and I think some of us exist within a social bubble where we might expect that every woman understands that physically is important in pregnancy and remaining active is super important. But that isn't necessarily the case across the country. And so, of course, I will take this opportunity to kind of talk about the guidelines and explain them, because essentially they are simple. They are that all women should remain physically active during their pregnancy if they have no contraindication to do so, i.e. they haven't been told by their healthcare provider that they need to either modify or reduce the amount of physical activity that they do. And what's important is that regardless of whether you have a medical condition or not during a pregnancy, or a complication or not, that you reduce sedentary behavior as much as possible. The guidelines for an uncomplicated pregnancy are therefore that you accumulate, or you work towards accumulating 150 minutes of moderate intensity physical activity per week, aerobic physical activity, and that is where you can talk, but you cannot sing. So you're still getting a little bit breathless, you're still working hard to get those benefits of exercise, and that you accumulate that over at least 3 days in the week, and in as short as 10-minute bursts each time. And additionally, alongside the aerobic cardiovascular activity, we are advised to perform or engage in at least 2 strength-based sessions per week.
Okay, gosh, yeah. So it's quite a lot, but it doesn't sound maybe as daunting as you might think when you're talking about 10-minute bursts. So I suppose, Lulu, I was going to ask you, what that kind of means. How does that sort of translate in terms of the types of activity you do? Obviously, from what Amal's saying, it's not like you need to be someone that's running marathons through their pregnancy or a real gym bunny, but actually you can do sort of more gentle stuff and still find a benefit from that.
Yeah, I mean, Amal's explanation there was perfect, because I think highlighting the fact that what we're trying to do is reduce being sedentary. So we are all going to translate being active very differently. it's a very subjective topic, and the most important thing I always say is we've really got to find what you enjoy. There's no point really finding something and sticking at something that you really don't like and you really think, oh, I've got to get that done this week. So yeah, yes, we're potentially heading into a lockdown which does limit options. Like swimming's always a really good one, but potentially that might be out of the window too. Walking's brilliant. It gets us outside, which was hugely important when the first lockdown. So again, that might be something that we need to focus on. But it could be switching your favorite music on in the kitchen and having a bit of a boogie with your kids or with your husband or with your dog or whatever, just doing something that's fun. And as Amal said, again, it's elevating your heart rate, and it's potentially bringing you slightly breathless. We don't want you out of breath, but we want you, noticing that you're elevating that heart rate. That's what's going to get us that cardio benefit. And then if obviously the strength workouts is a bonus. I'm a big advocate of strength workouts, but that can be lifting tins of beans in your kitchen workout. It's about being creative and finding ways of being active that you enjoy. I think that's the most important thing.
Definitely. And so why, Amal, is it so important to be active in pregnancy? Why is it a recommendation? I mean, obviously it's encouraged to be active generally, even if you're not pregnant. But why is it particularly important in pregnancy, and what are the benefits that people find from doing so?
I think in general, we can safely say that it's during pregnancy that a woman first faces a specific increased risk to her health. So it's a key opportune moment to examine your levels of physical activity and start to do something about it. And the specific benefits to health and to your pregnancy health would be a demonstrated reduction in risk in the development of gestational diabetes. Gestational diabetes doesn't necessarily only affect you in pregnancy. It can increase your risk of developing diabetes, type 2 diabetes in the future. So that's, I think, a really, really key one. It also reduces your risk in developing preeclampsia, of developing gestational hypertension, so high blood pressure during your pregnancy. And again, that risk can carry over into your future life as well. And it can also reduce the risk of you having a large baby. And all four of those risks can be reduced by around 40% if you are physically active within those guidelines that I spoke about. And so that's a huge risk reduction. Yeah. It also reduces the risk of you developing mental health problems such as depression by up to 70%, which is huge. And again, that's reflected in that paper that published the statistics on the reduction in physical activity rates during the COVID lockdown. It had a huge impact on mental health. It can also contribute to reducing pain associated with pelvic girdle or low back pain. It can reduce the risk of you having a prolonged labor, an instrumental delivery, or an emergency C-section. And it can also reduce your risk of a preterm delivery. So wow. Huge number of benefits.
It's almost, the question would have been better to say, perhaps, why wouldn't you be active in pregnancy with such a huge list of benefits? And it's amazing, really. So, Lulu, if someone's watching today and they're maybe thinking, I'm not a very active person, I've never really been into physical activity, but I am now pregnant and want to start something because I realise all the benefits that Amal has just listed there. Is it okay to start something new for the first time? And, if so, what sort of things might you kind of start off with to build up your fitness, assuming that you can do that while you're pregnant?
Yeah, again, so starting something new, starting anything new, we need to start gradually. I think we'd say that to anyone, but in pregnancy in particular. I think with general activity and raising your activity levels, what I generally say to people is we're looking for 15 minutes non-stop 3 times a week as a starting point. And then you gradually build up. So that's a good indication of how much time to spend and how many days per week. In terms of what type of activity, things like low impact, so sort of Zumba style things you might find online, cardio workouts that are body weight, that are pregnancy specific, they'd be great to give a try. There will be lots of them on lockdown, again, I can guarantee, and there still are a lot pre-lockdown available. In regards to new activities to try, I think a biggie has in the past been lifting weights, because I think there's been information out there previously that has said if you haven't lifted weights before, you mustn't start lifting weights in pregnancy. And that now is considered outdated because we've got a lot of people who have advanced their training in terms of pre and postnatal qualifications. So can really assist you in getting started. Obviously, you're not going to step under a 20-kilo barbell straight off the bat if you've never done that before. However, as I mentioned earlier, you could pick up some tins of beans and you could just start doing little things with that, or bottles of water at home. That's technically lifting weights. So again, it's starting gradually. If you're not sure, obviously speak to a midwife or a doctor, or find a pre and postnatal fitness coach to assist you. Having said that, there obviously will be some caveats to that into starting new activities. We don't want you starting high impact stuff like boxing. We don't want you doing anything that's going to, have a high impact, high risk of you falling over, like downhill skiing, if that's an option for anyone right now, or even things like horse riding, So we're going for low risk. We're going for fun things. But if you're interested in starting something new, like lifting weights, it's, as we know now, very beneficial to you and advised to do so, but do find someone qualified to help you if you're not sure.
Right, that's some good advice. And so if, Lulu, you are already into your fitness and you are now trying to maintain a level of fitness while you're pregnant, do you need to be more mindful of things like your pelvic floor and your core in pregnancy than you would be otherwise? And are there sort of different things you should focus on at different stages? And I know that's a huge question because that will vary massively from person to person, but as a general rule, what would you say?
In a general rule, very generalized, the answer would be yes. I think with pregnancy, there are so many physiological changes that are going to occur. However, a lot of those changes we can kind of predict or we can see ahead. So we can train smart, and core and floor is an area that I generally advise women to just be aware that that is part of the body that's going to be under quite a bit of strain as we head towards the end of the second trimester and certainly into the third trimester. It's carrying a lot more weight. It's seeing a lot more stretching in the connective tissue and the muscles. So I think training around those physiological changes is what we need to be doing to train smart. And so then what we're not doing is we're not reacting to symptoms when they occur. We're sort of thinking, okay, you know what? I'm going to get to know how to train my tummy and my pelvic floor now, maybe in the first or let's say early second trimester, so that once bump's really quite big and quite heavy, that I'm not just trying to, minimize leaking. I can sort of try and prevent it or minimize it before it even begins. So yes, core and floor is really important. I'd say it's one of the biggest areas of the body that's going to see the most change.
Yeah. Okay, great. And then, so Amal, I mean, obviously Lulu mentioned downhill skiing then, which I'm not sure many of us are going to be doing this winter, but you never know. But I mean, is there anything that specifically should be avoided? So I think now people are maybe a little bit more accepting. For example, I always come back to running, but of running in pregnancy, which I think people were quite horrified about even 5 years ago when I had my youngest. And I think my understanding is that generally that's considered okay, providing that you've done it previously. I mean, is there anything that should be avoided, and also are there any signs that you should really look out for from a medical point of view that would indicate you need to stop what you're doing and either modify or just stop completely?
Yeah, so we have a list that most people agree with. There essentially are activities that should be avoided during pregnancy. They're all very sensible. So exercising in excessive heat or humidity, activities involving physical contact. So, for example, playing rugby, anything with a danger of falling, really, which is what Lulu was alluding to. Scuba diving, of course, because of the pressure changes, and similarly, any activity at high altitude if you're not considerably acclimatized to altitude. And absolutely, it's okay to run. If you run, continue to run. And, there are lots of bits of advice around as to how to modify or approach your running if you are a pregnant runner. And we just need to be more encouraging of keeping active women active and not preventing them from doing activities that have not shown to cause any harm. And of course, that's just following normal guidelines, so that if you don't have any considerable musculoskeletal or pelvic pain, you're not leaking during running, you don't have any symptoms essentially during running, then you're absolutely fine. And then obviously there are lists of symptoms that you should be aware of that would essentially tell you whether or not it's safe to continue being active. And I like to write these down just because I don't always reel them off the top of my head. So being persistently or excessively short of breath. So we spoke about shortness of breath being, you know, a positive indicator that you're working within that moderate intensity range, but that it's alongside being able to talk in a sentence, not necessarily being able to sing, like I said, but still being able to speak. If you are persistently and excessively, even beyond stopping, short of breath, then you should stop and seek help. The same with chest pain. So again, this is all really normal, sensible advice that applies to all physical activity, not just pregnant women. However, those that are specific to pregnancy would include regular and painful uterine contractions. So that would be a no, stop, seek help immediately. The same with vaginal bleeding, and I'm sure most people would react to that in that way. Any persistent loss of fluid from the vagina that would suggest rupture of the membranes or preterm labour, and any persistent dizziness or faintness or frank fainting, and any dizziness that doesn't resolve with rest. And that's always the sign, you know, if something's not stopping with rest, then you really need to go and seek help.
Okay. Yeah, that is a long list. I don't blame you for writing that one down. But
it's important. I don't want to forget,
yeah,
you know, one.
It's so important.
It is really important. And I think some of those, like you say, you would probably obviously seek help for, and others maybe are less obvious. So I think it is really important to list those. So if we kind of move on,
I was just going to add, I'm really sorry because I know I probably should have just gone into this, but there has been a recent paper that I think is one of the most important papers to be published this year about exercise in pregnancy, which is an evidence-based critique on the research base that has guided the worldwide list of contraindications to exercise in pregnancy. And they are lists of pregnancy-related conditions that would either have completely precluded a pregnant woman from being physically active, total, or be classed a relative contraindication where a sort of modification on the amount of physical activity that was appropriate for that woman. That's how that would be classified. Now, a group of researchers who are doing great work in Canada have essentially revised this list, and they found 11 conditions that had no evidence to suggest that it was more safe for those women to be physically inactive or bed rested. I won't go into everything right now, but essentially what I'm trying to say is that it's really important that you are given evidence-based advice by your obstetric healthcare practitioner. If you have a twin pregnancy, for example, that's one of the big ones I think that we should mention. There is nothing to suggest that you shouldn't be physically active during your pregnancy. And if anyone has any specific questions related to medical problems, then definitely ask them now, because I can refer to those guidelines happily within the Q&A.
Brilliant. That's great. Thanks.
I think
Amal.
that's a big one as well for the twin pregnancies, because I think up until now that's been a huge fear factor for mums of multiples. There just hasn't been the guidance out there to let them know what they can be doing, and as we know, it's got such a big effect on mental health. So that I saw you highlight that a few months ago, actually, Amal. So that's a biggie, I think.
Yeah, definitely. Yeah. So if you've got any questions, if you're watching, please do put them, through, and we'll try and answer those later. So, I mean, the thing is, it's such a huge subject area, and we could kind of really talk a lot about it, for a long time about it, but I'm conscious of time. So I think what I'll do is maybe now move on to the bit around postnatal recovery. And Lulu, maybe you can answer this one. So the 6-week point is always seen, I think, as a real milestone for when you can resume physical activity. And I think, a lot of people do wait that long, and a lot of people don't. I know I certainly didn't, and I didn't do myself any favors in trying to do too much too soon postnatally. And I do understand, while there are obvious sort of psychological and physical benefits to being active in pregnancy and returning to activity, I think often it would be fair to say a lot of us also have a kind of aesthetic goal in terms of, I hate the phrase bouncing back because people do use that, but you know that there is a societal pressure that lots of women feel about wanting to lose baby weight, or however you want to put it, after they've had their babies, that sometimes would encourage them wrongly to return to exercise too quickly. So how important is that 6-week goal, and is that a tick in the box to say, right, go for it now and rebuild your fitness and do whatever you were doing before?
Again, this is just such a hugely subjective area. I've met mums who have had, luckily, very, very easy deliveries, and felt really good mentally and physically, and were up and about doing stuff within a couple of weeks. Personally, I tend to be a big believer in allowing the body some time to heal. The problem I see, yes, there are some aesthetic goals that some of us, you know, feel under pressure to hit, but I think there's also huge pressure on us as women just to do everything. And those who've got older children, when they have a second or a third, you know, there's a school run to do, and there's laundry loads to do, and there's shopping to get, and this, that, and the other. And I think we feel a bit guilty just sitting in bed or sitting on the sofa. So I think we really do need to try and push the message to women that actually the body is an incredibly clever structure that knows what it's doing, but it does need time and space and nutrients and hydration in it to be able to do that job. And sometimes if we push ourselves too soon, all we're going to do is hold that recovery process back. So go back to the question, some people might be up for going for walks and doing some gentle core and floor stuff in the first few weeks, which I'm not against if you feel up for it. But there are some women who will need to wait a lot longer for that, especially with major abdominal surgery, or, you know, major tearing, or episiotomy and things like that. Really do need to be taken into consideration when we're thinking about the healing process.
Yeah, okay, that's great. And so, Amal, at the 6-week point, you know, that's when women also have their check with their GP, and that's sort of often seen as the kind of sign off, if you like, to go and resume exercise. And would you say that that's enough? You know, what are things being picked up there that women should be aware of if maybe they're not at that 6-week check?
So the 6 to 8 week GP maternal check is not designed to sign you off, give you the green light to return to exercise. It is a safety net for you to use, and I would advise women use it wisely to bring up any symptoms that are still persisting. That, I think that's the message I would drive home about the 6 to 8 week check. It is not a sign off. It's almost a point in time, you know, along the road of recovery. And that looks different for everybody. 6 to 8 weeks is not the end of your postnatal recovery. So it's a chance to bring up any symptoms and to discuss with your GP that if you do develop symptoms in the future, and we're talking really here, symptoms to do with scars, any ongoing issues with your tummy, and with your pelvic floor, so incontinence and prolapse, typically, that you know what to do if that develops as you increase your exercise load going into the near future. So I think that would be my message for the 6 to 8 week check.
Yeah, and so would that be the time where you would perhaps go and see a women's health physio as well to get an internal examination to make sure that things are healing as they should, or what would you suggest? So
in the NHS, if you have at 6 to 8 weeks symptoms of incontinence and of prolapse, for example, and you didn't sustain a high-grade perineal tear or significant complications, so that 3rd or 4th degree perineal tear, then your GP will most likely give you advice, maybe check in with you 1 or 2 times at most, perhaps over the next 3 months, to see if, for example, pelvic floor muscle exercises and maybe a change in your load and an increase in rehabilitative whole body exercises made a difference to your symptoms. If they didn't, then I think at that point, a women's health physio referral will be absolutely appropriate. Of course, there will be other women who would like to take a sort of more preventative catch-all approach and might wish to pay to see a women's health or pelvic health physio privately. And they're your 2 avenues. And I think that's what the most common pathways would look like.
Right, okay. And so if issues are picked up, and this would probably be like the last question that I'll put to you in this part of the session. So Lulu, I know I'm not sure now if I mentioned earlier or not, I suffered a prolapse after the birth of my third baby. So that was something that was picked up at 6 weeks. And I think, did you mention, Lulu, you suffered, was it an umbilical hernia with one of your children?
Yeah, that was my eldest. Yeah.
Yeah, so if you have issues like that get picked up, what does that mean for exercising? Does that mean that you have to stop entirely? Does that mean that you resume but carefully to see what symptoms are caused by it? What would you advise if someone has issues that have been picked up in a women's health check?
I think if they've been picked up by a women's health physio, I would run with the advice that the women's health physio is going to give you, because chances are they will give you some rehabilitative exercises to do. Nothing really gets better by not doing anything. So, you know, the advice of don't lift and don't move too much. You know, we are busy women, all of us as mums are busy women. We all move a lot. We have car seats to pick up. We've got prams to put in the boot. You know, we might have older children. So I think very much if something's been picked up by the women's health physio, you will likely make an action plan with them of how to progress into exercise. So if it's running that you want to get back into and prolapse is something that you've picked up with the physio, then the rehab stages first, and then, you know, and you say you kind of making that plan with the physio by saying, this is what I want to do, how do I get there? And that's what physios are brilliant for doing, is helping you to build that roadmap. It's not going to be a never. I mean, I can't say that for every single case, but for mild to moderate prolapses, it's not a never, it's just, it's not now. And let's be smart and be appreciative of what your body's been through, and that it's going to take a bit of time to rehab that. And it was the same with my umbilical hernia. I had to have it repaired surgically, so I'd take out some time with that, and then there was rehab work to do, and then I actually fell pregnant with my second. So I've had a continuous journey with diastasis, and it's one that I've worked through mentally and physically, because I know sometimes you have those mental blocks, and prolapse patients and clients of mine, there's definitely a mental block where you think, oh my gosh, you know, things are falling out my vagina, I can't move. And it's the fear factor. And it's the same with diastasis. That we definitely went through there was this growing awareness of what diastasis was. And then it was like, oh my gosh, my abs have split and I'll never be able to do anything. And all this doming, what do I do? And I was guilty of that. I remember there were some exercises where I saw the doming and I was like, well, I'm not going to do that one. I'll do something else instead. I'll do some more glutes, or I'll do upper body, you know, and I just avoided it. So I think we as an industry have a lot to do in changing people's perception around symptoms like diastasis, prolapse, hernias, pelvic floor dysfunction. My phone just fell out. Sorry. And just helping to educate and empower those women to find their route back to movement that they enjoy.
Brilliant. Great. Well, that's been really interesting, and I feel like I could sit here all afternoon and just throw questions at you, but I'm sure Lucy's probably got some more questions as well. So I think maybe we'll wrap it up there. I just want to end by saying a quick thank you to Let's Bab for allowing us to put the panel together today. And if you haven't come across Let's Bab before, go and check them out wherever you download your apps, because it's a fantastic shopping app where you can kind of earn commission when you shop through loads of high street brands, and Natal Active are on there as well now. So thank you to them for giving us the opportunity to put this together today.
Amazing. Thank you, ladies. That was really interesting. Oh, I think I'm joining you. Hello.
Hello.
Someone's in there to join you. Thank you, ladies. That was very interesting. And you're quite right, Claire. We could chat about this all afternoon. But a big thank you to everybody that's watching, because questions have been coming in. So I'm going to give you those questions, ladies. And perhaps I give them to you, Claire, and you can then put them to who you think might be appropriate to answer. So the first question we've got here is, what level of activity do you recommend for women who have had several early miscarriages, are worried about doing anything else but resting once they're pregnant?
Well, Amal, you're probably from the doctor point of view the best person to answer that question, I think.
Yeah, this is a brilliant question, because this highlights one of the main findings of that research paper that I mentioned that challenged the list of relative and absolute contraindications to physical activity in pregnancy. What I would advise is that there isn't any solid evidence to suggest that exercise is a contributing factor to miscarriage In fact, we know that physically active women have better outcomes when it comes to term pregnancies. So I would encourage anyone who is concerned about everything and keeping active in their pregnancy to obviously do what is within your comfortable zone for your mental health. Obviously talk about it as much as possible and seek help for that mental health side of it if you need to. But know that being physically active within the recommended guidelines, so say you find out you're pregnant and you don't know how to progress from that point with your activity, just continue to be less sedentary, work towards accumulating those 150 minutes through short bouts throughout the week. Don't overexert yourself if you're feeling knackered and tired, just like anybody else in the first trimester. Listen to your body. Your body will always tell you what is appropriate at each stage. You know, if you're tired for a reason. So just rest, but know that if you do, say, take stairs and you get a little bit breathless, but you're still feeling okay, that's absolutely fine. If you still want to do some yoga and some strength training and you feel great, that's fine.
Great, thank you.
Thank you. Thank you. Great answer there. Hope that's answered the question there. Next one I've got here is someone saying, I used to run sporadically pre-pregnancy. I'm currently 19 weeks and I'd like to do some jogging again. Is this advisable or should I not start cardio at this time?
Lulu, do you want to take that one?
I mean, okay, I'll definitely. Cardio, in terms of starting some cardio now, yes, great. I think with running at 19 weeks, generally I'd say at this point we need to think about is risk versus reward. How much do you love running? And are you aware of the added pressure that that's going to place on your pelvic floor in doing so? If it's something you absolutely love and you're like, well, that's really what I want to do, then you can give it a try in a short burst. But as Amal sort of made reference to, if you then find you feel fine after that and actually you feel great, then carry on in those small doses. Don't suddenly go and do a 10K. But if you find that a gentle jog then does produce symptoms, if you find you're leaking urine, let's say afterwards, or you're just feeling a bit heavy, if the ligaments around your pelvis aren't feeling 100%, then maybe it's a sign that finding a low impact version of cardio might be a better option. I got a feeling maybe what you're alluding to is sort of the endorphins that you get from a run. We can replicate those in many ways, and I have done with runners who just haven't felt too comfortable running once they've got into that second, third trimester, just with low impact versions. But yes, go and give it a try. Give it a try in a short sort of maybe 5 minutes, maybe go around the block, see how it feels. Don't go in too soon, too heavy, basically.
Thank you, Lulu.
And it's always
It's
always an option, isn't it, that you can try a walk, a bit of a jog, keep the cadence really
like a
high.
5K.
So keep your feet under your hips. Just be aware of your breathing throughout. You know, there's certain things that you just want to think about if you haven't run for 19 weeks, which is the impact through the pelvic floor, as Lulu was saying. So if you are going to do it, fast walk, a little bit of a jog, keep the feet underneath you, lots of short steps, keep breathing throughout,
that's a good one,
keep
short
relaxed
strides
through the pelvic floor, and see how it goes. Good luck.
Amazing. Thank you. Now, this is a good one. This is an interesting question. Someone would like to know, what is a good approximate pulse while working out?
Ooh.
Is that a tricky one?
Yes.
I thought it might be. We're here to trick you.
I'm going to suggest Amal answers that.
Yeah, I have them written down somewhere. We've definitely got them in our pregnancy by Umi exercise section, because it is important. I think more important than heart rate zones is understanding what moderate intensity means to you in terms of rate of perceived exertion. And that, I know I keep saying it, and it's such a beloved phrase of sport and exercise medicine physicians, but it's the talk sing test. If you can talk, you can complete a sentence, then that's the level of exertion you need to be working at. There is no evidence to help us understand the safety of heart rate zones beyond a certain number.
Yeah.
And obviously it's going to be age specific. So there are zones that are felt to be demonstrative in pregnancy of moderate intensity activity and low intensity. And they're around 10 beats per minute higher than they would be if you weren't pregnant. So that beyond that maximum value, whatever your age is, we don't actually have any evidence to help us understand the safety of working into that vigorous intensity zone, which is why it's not recommended. And there are a few studies that have demonstrated reduced uterine artery flow, to the baby during that prolonged high intensity activity. But again, very few studies. So the most important thing is really to understand that you're working within that moderate intensity zone. If you agree with me, Lulu, on that explanation.
Yeah, I think that's the thing. I think we've moved away from the numbers nowadays, just because we understand that people work more efficiently in different zones depending on your fitness level and all sorts. And I think it's more of a widely accepted framework to work with, which is that talk sing test. So we know that you're in a safe zone if you can get a sentence out without gasping for breath. We know that your body is still managing to get oxygen to the fetus, and that you're working in that safe zone, and that's really where we want you to be. And as Amal sort of alludes to, there just isn't enough evidence for us to suggest that working any higher than that is okay. It might be for some people, but I think the vast majority of us just want to work out in a way where we're getting the benefits of exercise and we're safe. So that talk sing test is now very much the widely accepted test that we apply now. So don't worry too much about the numbers.
Thank you. I'm going to put two questions together now, and I think you did touch upon this, but it'd be nice to reiterate this because it's all about the pelvic floor again. Somebody's worrying about, running and the pelvic floor. They kind of think that doesn't feel great on the pelvic floor running. And they want to also ask, do planks, squats and lunges help with the pelvic floor?
Lulu, do you want to say?
Yeah, sorry.
I don't mind doing the running. I'll do running after you.
Okay, so what we talk about? So we're talking about planks, squats. Personally, yes, the whole body works as a system. You don't get muscles working in isolation. So squats, I actually always say, are great for your pelvic floor, because at the bottom of the squat, you've got the pelvic floor at full stretch, and then you have the opportunity to contract that pelvic floor in the upward phase of the squat. When I'm working with clients who are experiencing some pelvic floor dysfunction or we're later on into the third trimester, I sometimes get us to actively engage that pelvic floor and exhale on the effort phase of a movement. So you sort of inhale as you lower down into the squat, and we exhale and think about engaging the pelvic floor on the way up. That's a way of intentionally making it work for your pelvic floor. And I do that sometimes postnatally as well, because essentially that pelvic floor does know what to do. It knows how to support all your organs. It knows how to prevent leaking of urine and feces and stuff. But it just might need a little bit of extra assistance in those stages, the third trimester and early postnatal. But as I say, anytime you're moving and you are working muscles like the glutes and the core, you are going to be transmitting messages through your body system of fascia. So all the muscles work together as a whole body system. So just as we've said earlier, like strength training and working the muscles of the body, anywhere in the body, you are going to be doing yourself favors with the pelvic floor as well. Planks are one I'd like to highlight. Some people will feel fine doing planks, certainly in the first trimester, maybe even into the second trimester. It is a high pressure exercise or movement to be performing, and so it's one that we tend to find alternatives to in the second and third trimester, just because it is such a high pressure activity, exercise, movement, whatever you want to call it. So I wouldn't say that's the best for the pelvic floor. I think there are others that would be more beneficial. What was the other exercise we mentioned? Planks, squats, and
planks,
lunges,
squats, and lunges. Yes,
lunges. Love a lunge. Lunges are great. Again, anything that all the muscles around the pelvis. So if we're thinking about the glutes, they're a really good one to keep nice and strong to help kind of back up the pelvic floor, because as we know, we are in a state of altered an altered hormonal state during pregnancy. We've got something called relaxin, which is released to help loosen the ligaments within the body to help birth the baby. So the pelvis can be a little bit more unstable to an extent. So keeping the glutes strong is a way of ensuring the pelvic floor can get on with its main job of supporting the organs and preventing leaking, rather than having to stabilize. And sometimes that's what the pelvic floor muscles can do in pregnancy, is they can try and stabilize the pelvis as well as support the organs. So by strengthening glutes and your other leg muscles can be a really nice way of just ensuring the pelvic floor is not having to do too much. However, I would say lunges is one that can be aggravating towards there might be people suffering with pelvic girdle pain, which is a pain that we experience anywhere around the pelvic girdle, but mainly specifically at the front, the pubis symphysis, and then at the back at the SI joints. So there are ways of modifying your lunges just to ensure you're getting the benefits from them, which is strengthening the muscles in the legs and the glutes, but not overstretching the ligaments. So I'm waffling here. I could go on and on about whether exercises are good or not, but it's always subjective.
Thank you.
Do you want me to cover running, or should we leave running?
Somebody's just saying, I'm not feeling running, my pelvic floor doesn't feel secure running.
Yeah, so, that's not a surprise, because impact through, the floor, through the legs, and into the upper body, it essentially goes through the pelvic floor. And what the pelvic floor usually does with running is it relaxes and then contracts. It relaxes and contracts, and that's a normal phenomenon. And what you're asking pelvic floor during running is to withstand the impact and to contract in a way that stops you from leaking or developing prolapse by counteracting downward force through gravity. So not only does it need to be strong enough to do that, it needs to be functional enough to do that. It needs to contract within its full range, which means, sorry, I don't know why I'm doing this over and over. It needs to be able to fully relax down so that it can move through its full excursion up to contract maximally. And it needs to do that with coordination with the diaphragm at the top. So as you inhale, the pelvic floor needs to be able to nicely relax down, and as you exhale, it needs to nicely up synergistically. So that's quite a lot going on. And if any of those one factors is sort of out of sync, or anything in the whole of your body chain from your feet up is slightly awry, it could present as a funny feeling or a lack of coordination or full contraction in the pelvic floor. So that's totally normal. And I think what I would say there is that you obviously need to modify your running activity so that that doesn't necessarily happen, whilst working on the strength and functionality of your pelvic floor through that relaxation and contraction. And then build back up the impact so that you can withstand that activity. And it might be that if the case is that in pregnancy you aren't quite managing to have full pelvic floor control during impact activity, that you reduce the degree of impact by perhaps slowing down the running, shortening your gait, so shortening your stride, slowing down to a fast walk, or taking it onto a treadmill incline and walking uphill to a degree that gets you out of breath for that talk-sing test. That's really great for a sort of modified running activity during pregnancy. Again, on UMI, we've got loads of information about this, as well as a return to impact guide that talks you through rehabilitating your core and pelvic floor to withstand impact postnatally. But the everything applies during pregnancy as well. So I would have a look at that if you want some more information.
Thank you. Thank you very much. Thank you. We've got lots of questions. We've only got just under 5 minutes left, so we'll get through as many as we can. And I thought this was an interesting one. Someone likes to bounce. Is bounce safe in third trimester? And when can I start again after birth?
Lulu, do you want to do it?
Yeah, I mean, I think your explanation then of the pelvic floor and the functionality and the coordination is a biggie. I mean, if they're symptom free and they're enjoying it, I don't see why not. I mean, it's the bounce, obviously, and the thing about a trampoline is it's a specific type of coordination that the pelvic floor needs to manage. It's that landing and that sort of the rebounding. So I know a lot of pregnant ladies and even postnatal ladies sort of even the sheer thought of a trampoline, makes them shudder. But if this is something that your body has been conditioned to and you are enjoying it, then I think then by all means continue. I think Amal explains the coordination beautifully. So I don't know if there's anything to add specific to trampolining.
I think if you are developing any symptoms during any activity of pelvic floor dysfunction, you develop any incontinence, any prolapse, even asymptomatic prolapse, you might want to check yourself and just have a feel and see if there's anything there that you're not necessarily sensing. Incontinence, we speak about incontinence of wind, not just urine, headaches and any pain around the pelvis. And it's probable that most people in the third trimester would find it difficult to rebound without any of those symptoms. You can absolutely modify the activity if that's something that you're looking forward to getting back to postnatally. So stomps and stamps, sort of step up movements, keeping anything like that going as long as you're symptom free during the third trimester that would make your return to rebounding easier on the other side, I would do that as well.
Thank you. Thank you very much. We still got a lot of questions. A couple have come in of people concerned because they're asthmatic. Exercise induces asthma, so they're worried about that. And there was another asthma one. Let me see if I can find it. Someone else is asthmatic and they use inhalers regularly. They would like to go out jogging, but is that a great thing to do now? What things should they be worried about there?
So as with anything with asthma, you need to make sure that it's very well controlled on whatever medication you're taking. So at a baseline, without bringing activity in to complicate matters, things are well controlled. If that's the case, I would try a brisk walk and see how you feel. If you have any issues, if you have any post-exertional cough, any post-exertional wheeze, or you feel like you need a change in your medications or things just aren't controlled with them, just go and see your GP and have a chat about that. The benefits of physical activity apply to everybody in pregnancy, and it's important that asthmatic individuals can also benefit from being physically active. So definitely talk to your GP about that if you have any concerns.
Mm-hmm. Also, another one we've got before you go is, it might be quite a nice one. There are a few questions we've not been able to answer, so there might be a nice chance that you ladies can have a little look at the chat afterwards and maybe go in and answer some of those. But I think what might be quite nice to finish is people that are needing some motivation as well, that are perhaps, at home. We've got one lady here who's currently locked down in Wales, and she's just looking for a bit of motivation to start doing some exercise safely. You can give some advice there.
I think, Lulu, you had some good advice earlier, didn't you, around finding just something that you love, even if it's going for a dance around the kitchen.
Oh, you can't beat a kitchen disco, can you? Put your favourite playlist on, even when, especially when it's raining outside, and just having a bop around your kitchen, because that's enough. A couple of songs, 3 songs of that, and you'll have some endorphins flowing. And I'm feeling it in the first trimester. Endorphins definitely help almost everything. So I would definitely start there. I think you will find people, especially if the rest of the UK goes into a lockdown, a lot more trainers doing stuff online. I was doing some low impact interval training during the first lockdown. I'm actually going to start those again in November. So if you want to come and join me once my nausea has kind of subsided, that's when I'm going to get going as well. But just try your favorite playlist. Try just Googling things that you love. Dancing, Zumba's always a good one. Yoga's great as well in the first trimester. And just have a look online, because I think you'll find, especially on Instagram, lots of communities of people, of other mums as well, who are looking for things to do, and there will be mums out there.
Thank you. Thank you so much. Time has
I was
flown,
going to,
ladies. Oh, carry on. Carry on.
No, I was going to quickly signpost everybody to the Active Pregnancy Foundation. They're, as I said, a charity, and they've got a wonderful website with a lot of information about how you can be physically active in pregnancy that might just quench that motivational issue there. So have a look there as well.
Amazing. Thank you. I just wanted to thank you all very much, and a big thank you obviously to Claire for hosting that. That was absolutely brilliant. And we probably need to give you a 2-hour slot because there's so much to chat about. Huge congratulations to Lulu. Best of luck with the rest of your pregnancy.
Oh, thank you.
Do go and check out Let's
Thank
Bath.
you.
And of course, Natal Active as well. We have got our next speakers in the green room waiting to go. So I just wanted to say a big thank you, ladies. Just one last thing before you go, Claire, tell us where they can find you on socials.
So I'm mostly over on Instagram on @natalactive. And it's spelt as it sounds. So, and I'll obviously on Instagram also share links for Lulu and Amal as well,
please.
and everything. So if you come and find me over there, I'll make sure I'll share everybody else's details too.
Yes, please do. And if we didn't quite get to one of your questions, just purely because of time, hopefully the ladies can come back and answer those for you. But thank you very much, and we'll see you again at the baby show very soon, hopefully.
Yeah, great. Thank you for having us.
Thank you.
See you later, ladies.
Bye.
So we're going to now get ready for our next talk, and we're going to be talking about babies' sleep next. This is a huge subject. And of course, you know, our little babies come along, they don't know the difference from day to night. And, you know, sleep deprivation, it is not easy. But hopefully our next speakers are going to really give you some great advice. And it's coming up next here on the Baby Show TV.